have any limitations, any things that we need to worry about or look at before? Anything that you can or cannot do?
No.
Okay, perfect. I'm just gonna wash my hands and put on some clean gloves. Okay. Good deal. And then I am also going to pull this curtain for some privacy so that we can get this assessment going. Now I have a couple tools here. I've got my tongue blade that I'm going to use to inspect your mouth and test some cranial nerves. I have my pin light, which I'm going to use to assess your eyes, ears, nose, and mouth. Also have my tuning fork here. This is going to be used to assess your air conduction and bone conduction. So I'm going to have that by putting it on top of your head for your rubber and then putting it behind your ear and beside your ear for the Ron test. I have my smell here so that I can test your nose, your cranial nerves in your nose. Then my soft, sharp, and dull so I can test cranial nerve number 5 with your sensations. And then my reflex hammer so I can test your reflexes in your arms and legs. Okay?
Okay.
Alright, perfect. So I'm going to start just by first asking you a couple questions. What's your name and date of birth?
Justin Turkett, 22 of 96.
Okay, and who's the president?
Trump.
And where are you at right now?
Hospital.
Okay, perfect. Patients will learn oriented times 3. So I'm going to start by going to the back of your head, and I'll use my tuning fork and my pin lock for this. Okay, yeah, if you could just sit back for me. I'm going to assess the head here for any lumps, bumps, lesions, checking for any symmetry problems here. Everything looks to be good. I'm also checking the skin and the scalp, making sure that there aren't any abnormal scars, bruising, anything like that. Everything seems to be good there. While I'm here, I'm going to check your ears. I'm going to pull the ear up and back. I'm going to look inside the ear for any drainage, any swelling, redness, anything like that. Do you have any tenderness to your tragus?
No.
Okay, any tenderness around the outside of the ear?
No.
Any tenderness to the lobes?
No.
Okay, perfect. I'm also going to go ahead and check the other side as well. Pulling the ear up and back. Do you have any tenderness in the tragus?
No.
Any tenderness around the ear?
No.
Any tenderness to the lobe?
No.
Perfect. No excessive drainage, redness, swelling, anything like that. While I'm over here, I'm also going to check the neck for any JVT. I'm also going to check this side as well for any JVT. All looks well there. I'm going to assess your bone conduction by doing the Weber test. I'm going to hit this tuning fork on my hand, and if you'll just tell me whenever you no longer hear the ringing.
Okay.
Okay, and then that's the Weber, and I'm going to go ahead and test the Ron by putting it behind your ear.
Okay.
And then beside your ear.
Okay.
Perfect. And then I'm going to assess cranial nerve number 8 by completing the whisper test. So what I'm going to do is have you cover up your left ear here for me, and I'm going to say something into your right ear if you'll just repeat that word for me.
Stocking.
Okay, and then I'm going to have you do the same to this one as well.
Christmas tree.
Perfect. That was testing cranial nerve number 8. I'm going to assess your lymph nodes, so I'm going to start by palpating the occipital, the postauricular, preauricular, post-cervical, deep cervical, submandibular, the submental right under the chin, okay, the tonsillar, and the supraclavicular. So I'm going to have you shrug your shoulders for me. Okay, and that lymph node is right down there. And I'm also going to have you go ahead and shrug your shoulders against my hands. Perfect. That's testing cranial nerve number 11 there for resistance. While I'm at the back of your neck, I'm going to go ahead and assess your thyroid. So what I'm going to do is I'm going to palpate here on this side, and then I'm going to palpate on this side. Perfect. No deviation or anything like that. I'm going to assess the trachea as well. No deviation. Everything's at midline there. Then I'm going to assess the carotid on this side. the carotid on this side. Okay, I'm also going to listen to the carotid as well as your thyroid, and I'm going to do that to both sides. Okay. And then the thyroid. And the carotid. And the thyroid. Perfect. Everything seems to be good and intact there. Okay, I'm gonna go ahead and move back around to the front here. I'm gonna put my tuning fork out of the way because I've already used that one. I'm gonna start by just looking at the overall face here. I'm looking at the skin, assessing for any abnormalities, any excessive scarring, any bruising, any excessive hair growth, anything like that. Everything seems to be normal. Okay, I'm going to also assess your eyes with my pin lock. So I'm gonna start by looking at your 6 fields of gaze. So I just want you to follow my pin lock with just your eyes. Perfect. And then I'm going to test accommodation as well. So if you could focus on this T back here behind me. And then just look right here at my pin. Perfect. And then I'm going to have you just watch my pin light again with your eyes. Perfect. And I'm going to test the light accommodation as well. So I'm going to look here to make sure that this pupil constricts as well as the other one. Perfect. Everything seems to be doing good there. That's testing cranial nerves 3, 4, and 6. Also tested cranial nerve number 2 before we came in with the Snellen chart. Vision was 20/20, so we're good there as well. I'm going to go ahead and just touch right below your eyes here. I'm going to look at the conjunctiva and the sclera of the eye, so if you could just look up for me. Okay, the sclera is white and the conjunctiva is pink and moist. Do you have any tenderness in any of your sinuses?
No.
Okay, perfect. I'm going to go ahead and move on here to the nose. So I've got my pin light again. I'm going to just look at the inside of your nose. I'm checking for any abnormalities, any lesions, any papules, anything like that. So if you just look up for me. Okay, no excessive drainage, no redness, no inflammation, anything like that. Septum is at midline, no deviation. Okay, so I'm gonna have you, I'm gonna go ahead and check the patency of them. So if you could just cover one nostril for me and take a deep breath in. Okay, and then do the other one. Perfect. Everything looks good there. Everything's symmetric at midline, no deviation, anything like that. I'm gonna go ahead and have you close your eyes for me. Now I just want you to just take a smell of this and just tell me what it is that you smell.
Apple.
Perfect. That's testing cranial nerve number 1. Okay. Then I'm going to move on here to the mouth. I'm assessing the lips, looking at the lips, make sure everything's symmetric, no abnormalities, crust around the outside of the lips, anything like that. Everything looks to be good. I'm going to use my pin lock and my tongue blade for this one. So I'm just going to have you open your mouth. I'm going to just take a look inside. Okay, everything looks good. Buccal mucosa is is pink and moist. Patient has all of their teeth. Gums are pink and moist. Okay, if you could just stick your tongue. There we go. And tonsils, no swelling, no abnormalities there. If you could say ah. Perfect. That's testing cranial nerve number 9. I'm going to have you close your mouth and go ahead and swallow for me. And that's testing cranial nerve number 10. I'm going to have you open your mouth once more. If you could just push up against my tongue blade for me with your tongue. Good deal. And on this side. Perfect. That's testing cranial nerve number 12. So we're done with that tongue blade there. And then I'm going to have you swallow for me. Perfect. That's testing cranial nerve number 10. And then I'm going to have you clench your teeth. Okay. That's checking for TMJ on cranial nerve number 5. And then I'm going to check cranial nerve number 5. Again, I'm going to have these 2 objects here. I'm going to have you tell me if they are sharp, dull, or soft. So if you can go ahead and close your eyes for me and just tell me what it is that you feel. Is this object soft, dark, soft, dull, or sharp?
Dull.
Okay, and this one,
Sharp.
and this one.
Soft.
Perfect. That's testing cranial nerve number 5 with a sensation. I'm also going to test. I also tested cranial number 5 with the TMJ, and then I'm going to assess cranial nerve number 7 by having you make a couple faces here for me. Can you raise your eyebrows up? Okay, and then can you puff out your cheeks? Smile. Okay, perfect. Everything looks to be intact there. All right, I'm gonna move on here to the abdomen or the chest area. I'm going to actually I'm gonna go ahead and do your arms first. So if I can see your arms, I'm just gonna observe them here, looking at the skin, assessing the skin for any excessive scarring, any lesions, anything like that. Everything looks to be good there. I'm going to assess the radial pulses here bilaterally. Okay, pulses are strong and equal bilateral. Then I'm going to assess your reflexes as well. So I'm going to start by assessing the tricep. So what I'm going to do is just have you relax your arm for me. Okay, relax. Okay. Okay, and then I'm going to assess the bicep. Relax. Okay, and then I'm going to assess the radial. Okay, perfect. I'm also going to assess the fingernails here and the capillary refills. Everything's less than 3. Okay, then I'm going to have you test the strength. So if you could just squeeze my fingers for me. Okay, and then push up against my hands. Okay, and then down against my hands. Perfect. Okay, so I'm going to go ahead and assess the back. I'm going to go ahead and assess your back. So if you want to just turn for me on the bed. Perfect. I'm going to start by assessing for primitives here. I'm going to have you say 99 for me. So anytime that I move my hand, if you'll just say 99 for me.
99. 99. 99.
Okay, perfect. I'm going to check for any tenderness. Was there any tenderness whenever I was pushing over there? Okay, and then I'm just going to check each spot. Okay, and I'm going to listen to you. So anytime that I put my stethoscope down, if you will just take a deep breath for me. And I'm going to assess this with both my belt and my diaphragm. Alright, good deal. And while I'm back here, I'm also going to assess for any sacral edema. Okay, perfect, none there. So I'm going to go ahead and, I'm going to check for chest expansion as well. So if you go ahead and take a deep breath for me. Perfect, expansion is bilateral. Okay, and I'm going to go ahead and have you turn and face me once more. And I'm going to do the same thing that I did on your back to the front here. So I'm going to start by assessing the fremitus. So if you'll just repeat and do 99 for me every time that I move my hand.
99. 99. 99. 99. 99. 99.
Okay. to listen. So if you'll just take a deep breath every time I move the stethoscope. Alright, perfect. So I'm going to go ahead and have you lay back for me. I'm going to listen to your heart sounds and then we'll move on to your abdomen. Okay. So we're going to start here by listening to your heart. So I've got a couple different sounds here that we're going to listen to. We're going to start with your aortic. So your aortic is right here at the second intercostal space on the right sternal border. And then the pulmonic at the second intercostal space on the left sternal border. Then the Erb's point at the third intercostal space on the left lower sternal border. Fourth intercostal space is the tricuspid. And then the fifth intercostal space is the mitral. And I'll listen to this for 1 full minute. Okay. Perfect. So then I'm going to move on to the abdomen here. And I'm going to start by auscultating and listening to your abdomen. And I'm going to start in the right lower quadrant. And then the right upper, the left upper, and the right upper, left lower. And then I'm going to listen to your liver, spleen, aorta, renal, and your iliac. So we're going to go ahead and do that here. And the liver is going to be right here. The aorta. Spleen. Renal. And the iliac. Then I'm going to percuss. Okay. Any tenderness?
No.
Okay, I'm going to palpate. If you feel any tenderness, just let me know. Okay, perfect. All right, good deal. So then we're going to move down to your legs. So I'm just going to assess the skin here for any bumps, lesions, abnormal scarring, bruising, color pigmentation, things like that. I'm going to feel for any sacral edema. Any edema to the lower legs, anything like that is good. I'm going to assess the temperature with the dorsal side of my hands. Okay, and then I'm going to assess the feet here. So we're going to start by assessing for the dorsal pulse, which is going to be right here. The tibial, which is back here. Okay, and I'm going to test the capillary refill. Okay, both in all less than 3 seconds. And then I'm going to test the strength of your feet. So what I'm going to do is if you can just lift up with your toes. Okay, and then push down with your toes. Perfect. And then I'm going to have you test your balance. So what I'm going to have you do is take this foot and rub it down this shin. Perfect. And then I'll have you take this foot and rub it down this shin. Awesome. No coordination issues there. I'm going to have you go ahead and sit back up for me, and I'm going to test your reflexes. Okay, perfect. So we're going to start by assessing your reflex here first. Okay, and then we're going to assess the Achilles. Okay, perfect. And then I'm going to have you stand up for me, and we're going to assess your balance. So if you could just stand with your feet together and your arms out and your eyes closed, if you can just do that for about 5 seconds. Perfect. And then I'm going to have you just step back to the back of the bed. And then if you could just go walk about 10 steps for me, about to here, heel to toe. Heel, toe, heel, toe. Perfect. Awesome. No issues with balance. You can go ahead and take a seat back on the bed. Okay, is there any questions that you have? Any concerns? Anything like that?
No, ma'am.
All right, well, that concludes my health assessment for you today.
Thank you.